Back here at Seven Rivers Health, if you didn't know, major depression affects over 15 million Americans. And that's a statistic that is kind of scary for some. Here with me is Dr. Brian Proctor. He's a psychiatrist from Franciscan Skemp Healthcare. And here we're talking about depression, and we're going to talk about some new testing that's going on at Franciscan Skemp that you might be interested in. First off, Dr. Proctor, thank you for coming here.
Thank you for having me.
Let's talk about depression, and how soon can a person start seeing depression?
Well, the depression is something that can show up in childhood. Children as young as 5 or 6 years of age have actually been seen to have depression symptoms and to show up with need for medications and treatment. What
types of things could parents be looking for as far as their child, even at that age? I mean, what kind of things?
Well, in the younger ages, you're looking more at a lethargy, not really wanting to play, not wanting to do anything, just kind of crying and not getting out and doing much of anything. They tend to just withdraw and be unavailable as far as just conversations, that sort of thing.
Mm-hmm. And as a parent, then, some parents might think, oh, it's just, a phase or something to that matter. But where's that line of thinking, okay, this could be something more? When is is there kind of a sign or symptom, or what types of things should people look out for by the time they think, oh, maybe it's time to go see somebody?
Well, if a child is withdrawn and not interacting like they usually do for more than 2 weeks, they should probably have their family physician look into what is going on.
Now, depression can start at that early age, but depression can go pretty much at any age. Again, the same kind of a thing. What should a person kind of look for themselves, not only maybe as a young adult, an adult, or even an elderly person? What kind of things should they look for themselves?
Well, when you get older, the depression tends to become more of a mood dysregulation than just withdrawal. And if you are sad all the time, all day long, or wake up feeling okay but get progressively more sad as the day goes by, that's a good sign of depression is starting to occur. And if you have more bad days than good for greater than 2 weeks, then you're starting to show the signs and symptoms of a depression. If you have problems with sleeping, you have a decrease in level of interest in things, you start feeling worthless or feeling guilty about sort of things. If your energy becomes poor, you have difficulties concentrating, difficulties paying attention to stuff, your appetite either goes way up or way down, and the most severe symptom would be if you start thinking about committing suicide.
Mm-hmm. That's the time you really need to start.
Yes.
Anxiety, where does anxiety come into play here?
Depression and anxiety really are regulated out of the same part of the brain. They're just right butt up next to each other, with the part that deals with depression, the part that deals with anxiety. And so if you have a lot of anxiety, there's a really good chance you're going to develop depression. And if you have depression, there's a really good chance that you'll have some anxiety as well.
So is it, you don't want people to wait until the last very minute to come and see you. So you talked about the suicide tendencies that possibly pop up. Where's the kind of thing that says, okay, now this is the time, I gotta be seen, I should see somebody?
Well, like I say, if it goes for 2 weeks, if you are in your 20s, 30s, 40s, 50s, a time where you would expect your brain capacity to be pretty good, and you start not being able to remember or start not being able to pay attention, and that's something new. That's one of the early signs of depression. You might want to go to your family physician. I would say that most of the time, if you have the early signs of depression, you have not gotten to the point of feeling suicidal, and you've never been on any medications, the first stop should be your family physician rather than trying to get in with a psychiatrist. psychiatrist. We're difficult to get into because there's not many of us, and family physicians are trained in dealing with the early stages of depression and do an excellent job of treating that level.
You brought up a good point, which is medication. Now, for some people who are depressed and such, they may think, oh gosh, here I got to go on medications, or I'm going to be on pills and more pills and more pills. But that's not the case, is it? Depends on the situation.
It depends on the situation. If you get diagnosed with a major depression, then you're probably going to be recommended to be on medications. That's the most effective means of treatment that we have. You'd probably be referred to a psychotherapist to talk about what might be affecting you and making the depression worse. In most cases, if it's your very first episode of having depression, then you're going to be on a medication. It's going to be about 6 months, maybe a year, and then you'll be tried off of the antidepressant medication to see if you don't need them anymore.
We hope that's the case. Now, there's something new going on between Franciscan, Skemp, and Mayo. That's kind of an interesting thing and sort of a new thing. The genetic testing, can you kind of talk about what's going on?
Yes, Mayo Clinic's been doing genetic testing for deciding which medications would work best for someone with depression. They've been doing that testing for many years. They've got the protocol down as far as how to go about doing it. They get a genetic sample, they run it through their machines, and they come out with a readout, and they say, okay, this type of genetic makeup will have this kind of effect on that medication. There's a whole 3-page report that I get when we do that. But it's not something that is really into clinical practice now. Folks like myself who see patients but don't do research have not been using genetic testing. We're doing a study with Mayo Clinic to measure the effect of introduction of this new technology on patient and provider satisfaction. How happy am I with the process of the treatment as usual, and how happy am I after I get the tool to use to be able to earlier on get a good medication and a good dosage of medication. And so that's the thing that we're testing.
Which in the long run could benefit patients in the long term, correct?
Well, the whole idea of using genetic testing is to tailor-make the treatment to that patient. If you come in and you're depressed and I get the genetic testing on you and it says this medication would work better, and I'm trying to stay away from using medication names, but this medication would work better, and these medications you'd have to take an awful lot of them, and because your liver metabolizes them very quickly, and this one you have to use a very small dose because your liver doesn't metabolize it very fast at all, and that sort of thing. If I could get that readout and look at that and say, okay, let's go with that one, and this is the probable dose that it'll have to be in, that makes it quicker to get into dealing with the problem, and it gets us a dosing that's going to work at the level that we're putting at, and that's good, because a lot of times the treatment as usual seems to be more of a by guess and by golly. Well, let's try this. Well, that didn't work. How about this? And so it's the frustrating for the patient, frustrating for the provider, and so if we have that information up front, we're going to be ending up with one drug trial rather than multiple drug trial, and that'll decrease the number of refractory cases as well.
For people who are interested in taking part in the study, can they call you?
Yes, they can call the Behavioral Health Clinic at Franciscan Skemp. It's 392-9555, and say that they're interested in getting in to be seen for the study. They'll get them set up with myself or one of my colleagues for an intake. We'll do an evaluation, and if they qualify for the study, then they'll be entered into it. You have to have the diagnosis of major depression or depression. Bipolar disorder is not something we're testing, so if you have bipolar disorder, you're not eligible.
Super. Dr. Proctor, thank you very much for coming in.
Thank you.
We'll have more Severn Rivers Health in a second. We'll talk about elderly eating. It's coming up in a minute.